Now, LoveLife has set its sights on transforming the menstrual health landscape for young girls across South Africa. The launch of the Oky App offers digital solutions that are both accessible and inclusive. The app promises to uplift and empower young women, empowering them to take control of their bodies and their health. To tell us more about the Oky App, we are joined by the LoveLife manager, Thilivhali Livhadi. Very good morning to you, Tili. Thanks for joining us. Welcome.
Morning to you and to our viewers.
Talk to us about this app. What does it seek to achieve?
Well, the story is that through our implementation of our programs in healthcare facilities like clinics, in youth out of schools and youth in schools, and in communities, we have realized that there's still a lot of problems with regard to menstrual health, to young girls particularly. The issue of communication. They find it difficult to communicate to their parents to say, now I'm seeing my periods, and they think that they will be scorned to say they are starting to play out with boys. When we go to school, they stop going to school or abscond from going to school. When they go to the clinic, there is issues of stigma. They can't tell easily. So throughout this interaction, we realized that there's a need for an intervention, and luckily UNICEF came on board to say they are going to partner with us in developing this app.
Okay.
So it's an app that we didn't develop alone as LoveLife, as UNICEF, but we involved young girls themselves to say we're going to develop an app that will be interesting to themselves so that they are able to use it. And then the features that are there have been co-created with young girls.
So can you talk about these features that differentiate it from the other period tracking apps?
Yeah, the difference with this app, firstly, is that it's zero rated, because it's targeting young girls who will have difficulties in buying, airtimes or data so on. So it's zero rated, and the difference is that it's particular to young girls. These other apps, you'll find them having serious issues of conceiving and all that. But this one particularly, it has features like tracking app. Firstly, how do they get tracking? After they sign in, they put in their profile. Then there's a question, a fundamental question that they will find on the app. When was your last menstrual period? Then when you put your last date, it then starts tracking. It will tell you, on the 14th day or 16 or 20 days to come, you will start seeing your periods. So then a young girl then stay alert to say, okay, now I'm aware, by this day I will be seeing my periods. And not only that, it then assists young girls to be able to track their ovulation. And this is a period where if they have intercourse with their boys or any other partner, then there are chances that they can fall pregnant. So then they are alert. If they have to be using protection, then they will use protection. But there's also an encyclopedia in the app. It assists young girls in finding out more information about sexual reproductive health. Like, there are myths surrounding menstrual health. Like this famous one that the young girls knows that, if you use a tampon, it will tamper with your virginities, then it able to tell you this is a myth, this is the truth, and then they go through that. Then there are also other features that if they are not finding them in the app, there's a hyperlink that it takes them to other youth-based apps that are health-related, so that they don't find themselves looking for information and not getting through.
Let's talk about the accuracy of this app, because I would imagine there's certain instances where the app is not as accurate as the physiological uptake of the girl is. Then there is fears of missed periods. So just how accurate is this app?
Yes, the app has been tested here in South Africa. Before we launched it, we had a pre-launch where we were checking all those issues to say how accurate is it. From the girls that we started up to the day of the pre-launch, which we called soft launch, then we interviewed the girls, then it was accurate. But beside that, it's the first in South Africa, but not first in the world. It was tested also in the Caribbean countries and other 2 countries in Africa, I think even Kenya. So when it comes here, we are talking about something that's very tested and is very accurate.
Okay. And then does it incorporate peer mentorship to this platform, and what role do teenagers play in terms of making it more user-friendly?
Yes, LoveLife, remember, our best model is peer-to-peer model, so we could not avoid to have that peer mentorship in the app. So there is this platform where young people also speak to each other on the app, like they have chats, and also we give guidance on the app. So it's not going to be driven by us as adults, but young people are involved inside to motivate and assist each other. But also we are making a very serious call to the parents, and particularly men, because we are not in the picture when it comes to menstrual health and hygiene of our children, of young girls. So we are making a call to say, let's start looking at this app. Let us be there when they download this app so that we know what is in the app, and then we get involved in terms of, if I'm lacking sanitary towels, then I must be involved as a father. Then the mothers will play their motivation and monitoring role as well.
So what strategies are in place then to ensure that this Oky app, reaches and effectively engages its target audience?
Yeah, we are rolling it out to all our programs implementation sites, like clinics, in schools, out of school when you do activations. But we are also partnering with other organizations to reach out where we might not be able to reach as LoveLife. To say, when you implement your programs, please know about this app, assist young people to download. And we also go to other communities where we run these mini launches in schools and also in community halls and community, these community crawl meets in villages where it might be difficult for them to get access of this information.
Yeah, and in the bigger scheme of things, in what ways does LoveLife and UNICEF envision the Oky app contributing to broader efforts to promote menstrual health, especially among young girls?
Yes, remember, these issues are interlinked. Recently, January or last year, towards the end, we're talking about the high number of teenage pregnancies, particularly in Gauteng and other provinces. So it's going to assist in eliminating the issues of teenage pregnancy, because we know that it's a problem. So this app gets you, a young person view, you are in control of your menstrual health and hygiene. And beside that, there's issues of, HIV and AIDS. We still have that problem. Then it assists young people to be able to eradicate or eliminate, the new infection of HIV and AIDS and other.
How does it do that?
I'm aware as a young girl that I have an app. Then I go to tracking my period. That's fine. I go to encyclopedia. Then there are issues about HIV and AIDS. How do you get transmission? How do you get infected? What are the symptoms of HIV and AIDS? What are the symptoms of gonorrhea and all other things? So awareness is no longer going to be physical only, but it's going to be virtual on their apps.
Oh, interesting. Thank you so much for sharing this app with us.
You're welcome.
We do appreciate your time. Thank you. That was LoveLife manager Thilivhali Livhadi talking to us about the app they launched called Oky App, which helps with transformation of the menstrual health landscape for young girls.